So conversion mastery. Well, how do we become really good masters at conversion? Well, it really comes down to communication. I think you would all agree, and I said this to our group the other day, is that you could be a really good chiropractor. You could be one of the best chiropractors as far as correcting spines and adjusting people. But if you don't have good communication skills, it doesn't matter. You're not going to have a big practice. In fact, you're going to be struggling in practice and you're not really going to serve a lot of people. On the other hand, you could be a terrible chiropractor, you could be a terrible adjuster, but if you have good communication skills and you can share the principle with people on a very high level and get them to buy into your vision, your practice explodes. So we're going to talk about putting all of that together this morning. So I'm going to try to relate this to as we do our examination, and typically for most of us on the line, we use some sort of objective findings, for most of us using x-rays especially. So I'm going to really relate this morning to taking x-rays and using those x-rays to really relay the message of chiropractic. So the number one point here, and I've got 6 points to share. Number one point is be a healer, not a technician. Well, what does that mean? Well, sometimes what happens when we get into this corrective model of care, and you're doing spinal correction 1 and spinal correction 2, the courses, you're getting certified, it's easy to become caught up and become a technician. It's easy to become caught up at drawing your lines and trying to be very mechanical as far as looking at the angles of the spine and the specific curves and the CD angle and the LD angle and your atlas angle and all these different things. But it's so important to make sure that we take a step back. And although that is so important, and I believe we truly have the best teacher of corrective technique in the world. I mean, Tony is second to none when it comes to correcting spines. But I think it's important for us as chiropractors to realize that we are not technicians, we are healers. So I made a statement here that says X-ray without chiropractic principle is nothing more than medical treatment. And I can tell you this right from experience, because in our first practice, we went out and we bought a used x-ray machine. This is going back in the early 90s. We bought this used x-ray machine, and we bought this digital processor, and we had the cassettes, and we had to change the films and everything. But the cool thing was it was an automatic processor. We'd actually advanced. We thought we were right at the cream of the crop at that point. There was nothing like digital x-rays in those days. But we didn't have the dip tanks. Some of my colleagues had those dip tanks where they had to take the film out of the cassettes and dip them in the fixer, and then dip them in the different chemicals to get an image, and then hang them up, in the red light room, in the dark room. So we actually had a dark room. We had this automatic processor. But at that time, we really didn't know. We weren't practicing any type of corrective type of care. So we took x-rays on almost every patient, but we did it to assess their spine and if it was safe to go ahead and adjust them. And as important as that is, I don't know that ever in my entire practice I ever saw somebody that there was a contraindication to make an adjustment because of what I saw in x-ray. I mean, I had people with fractures. I had people with all kinds of different conditions. I still adjusted them. I still, knew exactly what I wanted to do as far as moving the spine and getting pressure off the nervous system. So I know my wife, in a couple of certain circumstances, she had a couple of patients that ended up having Paget's disease or something that became a contraindication. So x-ray was beneficial in that regard. But if you're using it just for that, it really is just a form of medical assessment and medical treatment. So if we can get our minds to start to think about x-ray being an assessment tool for spinal dysfunction, for spinal decay, for degeneration, for subluxation, for alignment issues, and use it as an objective measurement so that our corrective care can make that change over time. And we have the ability to assess the person in that way and show objectively that their spine is changing. But beyond that, and this is where it gets really important, to be able to relate that to an allowance for that person to get their nervous system functioning better, that's where you hit those gold nuggets. You have to be able to communicate the ability for that person to have their spine corrected and move those bones and see the changes in the alignment and relate it to nerve function. That's where it gets so important, and relate that to overall function and healing. And when they can understand that in their mind, that's when you convert that patient from this medical mindset, from this paradigm where it's a quick fix mentality. So if you're attracting a lot of people through your marketing, whether it's online marketing or whether it's, referrals or whether you're going out and doing lunch and learns or screenings or makeovers, wherever they're coming from, unless you can connect the dots and take their symptom and relate it to spinal dysfunction and nervous system interference, you're not creating a lifetime warrior chiropractic patient. So we have to tie the dots together. So what I've done is I've listed a bunch of questions that I used over the years at different times that really helped the person to think and make good decisions about wanting lifetime chiropractic care. So after you go through your day 1, day 2, day 3, you do your doctor's report, and now you're doing an x-ray report to a person. And whether you do a live doctor's report or whether you do a one-on-one, there's always that preemptive part where you show them what a normal spine looks like and then what a decayed or subluxated spine looks like. There has to be that visual change. And then you can show them their x-rays, and here's some of the questions. You can say to the patient, and I would suggest you guys write these down because these are gold. Now can you understand why I was so concerned when I saw these x-rays? And the key is, and here's the communication key, is that when you ask questions like this, you have to be disciplined enough just to be quiet. You ask the question and you be quiet and embrace the awkward silence and wait for them to respond. Because when you ask this question, you have to give that patient a chance for their mind to start working, for their wheels to start turning, and them to process that question and then form an answer in their mind. Because when you give them that time and they're allowed to think and form the answer, you solidify that change in their paradigm. That's what happens during that time. And that is so vital. So now can you understand why I was so concerned when I saw these x-rays? Next question. What is this scoliosis, spinal decay, degeneration, subluxation? What is this doing to your nervous system? You're tying it together, and then you be quiet and wait for the answer. And you're waiting for them to say, oh, it's choking it, it's crushing it, whatever. And their answer is going to be 100% proportional to how you've prepared them for their, through your day 1, day 2, day 3, how you've communicated up to that point so far. And so that's a good metric to say, is my communication or are my communication skills good that I'm expecting and getting the answer that I want? If those nerves going to your organs get further damaged, will you get healthier or sicker? This is a huge question. And the patient has to start to think it's an obvious answer. If you don't do anything about this, it's going to get worse. If those nerves going to your organs get further damaged, will you get healthier or sicker? You're tying together the spinal decay, the nervous system dysfunction, and the fact that those organs are going to start to shut down. If you keep ignoring the problem or treating the symptoms, will this problem get better or worse? It's a simple answer. It's going to get worse. So you're preempting the fact that for them to say, after you've gone through all this, I need to go home and think about it. You're making this a very obvious decision for them. Help me understand how your life will be different if we can correct this problem. And this is a really great question because what happens is the person starts to think about how their life is going to change. And it gives them hope. It shows the light at the end of the tunnel. It shows them what they've been missing. And they actually think about it. That is a paradigm changing question. Help me understand how your life will be different if we can correct this problem. Huge question, because again, you're changing this person's mindset. Do you agree that corrective chiropractic care, what we do here in this office, is necessary for you? It's a yes question. Yes, as soon as and again, you be quiet, you let them answer. If they can say yes, they've made the decision in their mind. And then it's their decision to start care. It's not because you're talking them into it. And the last question, is your health, your healing, your function, and your life a priority enough for you to commit to doing this, to commit to engaging in this care plan and committing to this care plan? And it's a yes question. So you're getting them off the fence. So these are really, really gold questions. Here's the next thing. Always, and this is something I learned really early in practice, and I don't know who to give credit to, but what we did is we had pictures of these MRIs because I wanted to share with the person, if our goal was to remove nervous system interference, And think about this, you're spending so much time marking the x-rays. Now we got our x-ray marking software, and it's drawing all these lines. And here's the big problem, and I want you to recognize this. If your x-rays that you're showing to the patient looks like a children's scribble pad where it's got all these lines all over it, you're doing nothing more than confusing the patient. So be careful. It's important for you to know exactly how to correct the spine and how to adjust. Absolutely it is. But in relaying the message, this is where it can get really, really helpful. If you have this MRI picture there handy for them to see, and you can relate their spinal x-ray to this MRI and say, here's your x-ray. It looks a lot like this MRI picture here. Look what it's doing to your spinal cord. And just let them digest that. Let them think about that. So think about the messages from the brain going down to your digestive system, going down to your heart, going down to your liver, going down to your pancreas, going down to, all the way down your legs. Is this something that's going to allow your body to function at 100%? And clearly the answer is no. See, the thing is, if you're just showing x-rays with abnormal curves or even bone spurs or degeneration, people can survive with crooked teeth. They don't put that together. It's easy for them to say, I'll ignore it. I've got some arthritis. It's a problem. I can live with this. But as soon as you start relating that and showing them the relationship to function, that's when you change their paradigm. That's when you change their thinking. So unless you connect the nerve damage, it never becomes that important for that person. Next one, there has to be congruency with your care plan. So we're selling an outcome. Like, let's really be honest here. If you're doing corrective care and you're using x-rays to assess the person and you're measuring those x-rays for some level of outcome, you're selling the outcome. So have a care plan that's congruent, that gets them to that level of outcome. So keep in mind, remember, spinal problems, spinal dysfunction it's taken years for it to get like that. It takes years to correct. So have a care plan that's going to get them along that road, or at least advance them in that direction. So to accept a patient that is only willing to pay each time they come in or pay as they go, it's a complete incongruency. All you're doing is taking their money. You haven't done anything to get them into that corrective care mindset. So what I would suggest, if that's happening in your office, and I'm even going to say, and this might, ruffle a few feathers, is that I really feel it's a question of your own integrity. If you're really trying to promote corrective care, and you know that corrective care is what that person needs, and it's a form of care that you use for your family, and it's a form of care that you use for your staff, and you're monitoring the correction for every single patient, but you allow somebody to come in and just pay per visit, then essentially all you're doing is taking their money. Now, of course, getting adjusted, is one adjustment better than none? Of course it is. But if you really want them to have the best results and they need that corrective care, have a care plan that they can buy into, that they can jump into. And don't be afraid to say no to those people if they're not willing to accept your recommendations. So objectify your exam and objectify the care plan. Make sure that it's something that is congruent with what you're trying to deliver. Number 4, get commitment first before negotiating. So get commitment first. So a lot of people will want to jump right to what's it cost? What's the price? Well, it really doesn't matter if they're not willing to spend the time and the commitment it's going to take to do the home care, to be there as often as they need to be there, to get that correction that they really need to have. So as I mentioned, spinal and neurological damage take about 12 to 18 months to correct. It's taken years for it to get there. It takes at least 12 to 18 months to correct and maintain after that. So the question is, can you at least commit to the first 90 days? If it takes 12 to 18 months to correct, you've raised the bar so high, but then bring the bar down and say, hey, can you at least commit to the first 90 days? And most people will say, yeah, okay, that sounds reasonable to me. If you tell them, gosh, 12 to 18 months, a lot of people go, holy smokes, that's overwhelming. But 90 days I can commit to, 30 days I can commit to, 60 days, whatever your care plan is. But don't negotiate price until they can commit to the level of care you have. If it's a 2-week care plan, if it's a 1-month care plan, a 3-month care plan, 90-day care plan, whatever that is, have the conversation to get them to commit to the correction first. So again, sell the destination, sell the outcome not the journey. Number 5, never, ever, ever ignore the spouse and the children. So if you're doing any type of corrective care, this is the biggest thing. And I'm going to say this is what really, really exponentially grew our practice, because we got to the point where we would train with our team and we looked at every single new patient as a multiple of at least 4, because I would look at every person as having 2 children and a spouse. So one new patient came in and I'm thinking already spouse and 2 children on average. So I always thought that. So we basically said we want to be a family care office. So remember this, is that chiropractic care is not something people budget for. It's not like we're paying so much for our mortgage, we're paying so much for rent, we're paying so much for our car payment, we're paying so much for insurance, whatever that is. They don't sit there and say then, oh, we pay so much a month for our chiropractic care. Most people don't do that. So every single family has a process for expenditures. So the questions are, and you can start asking the questions or train your team. And we actually did this, is the team had a series of questions they would ask on day 1 or day 2. First of all, how does your family feel about you coming here for help? And the team would ask that right at the front desk, right on day 1, because they were asking strategically for a few reasons. Do they have a family? And then they would even go so far as to say, hey, what are their names? What's your spouse's name? What are the kids' names? How many kids do you have? So they would know before that person came in for their consultation or exam with the doctor, the staff at the front desk would know exactly what's going on with that family. So, and how does your family feel? Oh, and the person might say, oh, well, they don't even know, or, oh, they're very supportive, or, oh, he didn't want me to come here because he hates chiropractors. Whatever the answer is, at least you've opened up the door of conversation. And then typically I would ask after the end of day 1 is that most people ask their spouse, and this is a great way to ask for the spouse to be there. Most people ask if their spouse can be involved in this decision, because it involves a time and money investment, especially if you've got some serious concerns on your exam findings, on your x-rays. If it was my wife, I would want to be there for her. So most people ask if the spouse can be involved. Is it fair to invite your spouse to see your exam results? It's a very polite, very non-confrontational way to ask about the spouse coming in. And most people say, yes, I think that's a very good idea. So that's a great way to help getting spouses there. And the more spouses you can get to see the exam findings, a couple things happen. You get the support. The person doesn't feel guilty about spending the money or committing to the care because they don't feel like they're leaving their family behind, because they're getting the support of their family. And now you've opened up the door for educating a potential new patient and getting the children in. So that is so vital. So do you think the spouse would be concerned? Here's another question. Do you think your spouse would be concerned if they knew how severe this was? Right? So this is a great question. And again, you're changing the paradigm of what that person thinks from this is a simple muscle strain. I'm going to go see the chiropractor and get my muscle strain removed or get my back pain taken away, to now all of a sudden I have this serious subluxation pattern in my spine. I have this scoliosis, I have this spinal decay, and it's affecting me neurologically, and my body's shutting down as a result of that. This is a severe problem. It's a lot worse than what I expected. And here's a big thing. And this is what I always used to say to patients, and we actually trained our staff to ask this too. Studies show that these spinal and neurological problems are genetic. So if you're showing x-rays to somebody and they have a scoliosis, or they have some subluxation pattern, or they have an abnormal LD angle, or they have an alordotic spine, a kyphotic neck, these are genetic type of problems. Posture is genetic, especially on the same sex side. So if you see that in somebody, the first thing I would always ask is that, how many children do you have, and have they ever been checked? It's our policy to check children. All my children got checked and adjusted from the day they were born. I mean, it would be completely incongruent if I didn't insist that your kids get in and get adjusted. So it was a policy in our office that kids came in and got checked. Like, it was not a question. It was like, when are we bringing your kids in to get checked? Because it would be completely just an absolute oversight on my part. It would be ignorant on my part not to suggest that the kids come in to get checked. It would be unfair to those children for them not to get checked. So it's our policy to check your children. And we always said with our care plans is our care, and here's a great question. If you're finding that you're getting a lot of, I need to think about it, or people aren't committing to the care plan, or you're making deals, or your number one care plan is not the go-to thing for most people. You're giving some sort of a substandard care plan, or not the number one care plan that you would recommend for that person. If you're finding that's happening more often than it's not, then your care plan is not congruent with what you're delivering. So your systems in place have not gotten good enough to be able to justify that care plan in the patient's mind. All right. And here's a great way to test that is that have a very transparent conversation with your staff. And the staff are the ones that are going to be very honest with you. And just ask them, be as honest as you can. Your staff are in an income bracket that maybe the majority of people that come into your office are in. And if your staff legitimately can afford your care plan, then you've probably got a very congruent care plan. But if your staff tell you that that's not something that they could afford if they were a patient, then maybe it's time to reevaluate what your care plan is. I mean, especially if your staff are on board with what you're delivering and they understand the seriousness of subluxation, and they understand they've seen the miracles happen in your office. So they know how valuable it is what you do. But legitimately, if your staff can't afford your care plan, then you might want to start reevaluating where you're at. So have a care plan that's congruent with the population that's coming into your office. So you're getting 80 to 90% conversions as opposed to less than 50% conversions on your number one care plan. So just again, something to think about. Number 6 is embrace the hard conversations. So start calling out the uncertainty. And this is a really important skill to develop, is that let's address the elephant in the room. Don't be afraid to raise the bar so high. In fact, I sometimes would go into doctor's reports or go into x-ray conversions, and basically what I would do in those situations is I would literally try to weed those people out. And that was the thing, is that, you know, because some people, if they're on the fence, I want them to be fully committed. So I would try to have those hard conversations to make sure that they were fully committed, because I didn't want to try to attract people that wanted some sort of a substandard care plan, or I didn't want to attract people that wanted some reduced level of care or wanted to pay as you go. That was not the type of practice I wanted to build. And in fact, I would even say to you, if that's the type of practice that you're building, you're putting cancer cells into your practice. And you're building a practice that's just going to multiply in a way that's very different than the direction you want to go. So these are things to start to think about. So call out that uncertainty. So do you agree? And there's a great question. Do you agree, after you've seen the x-rays, that what we do here is different than anybody else you've seen, different than the medical profession, different than the physios, the massage therapists, different than other chiropractors that you've seen? Do you agree that we're different? And ultimately, most people are going to say yes. And we had that for years and years. Gosh, what you do here is so different. Why didn't somebody else tell me what you've told me? Why didn't anybody else take an x-ray and measure it? Do you agree then that the next question is, do you agree that this level of care is what you need? It's a great question. And if you can get a yes, then again, you've changed their paradigm. You've gotten commitment from them. So, and here's a huge question. And I would often say this in doctor's reports. If you decide to talk yourself out of this, or think about it, and again, I'm pre-framing before they see their own x-rays, if you decide to talk yourself out of doing this, or think about it, or do it later, will this problem get better or worse? And again, you ask the question and you be quiet. And you embrace the awkward silence, because it's that awkward silence that changes their paradigm, because their mind is spinning like a hamster wheel, and they're thinking, they don't want to commit to that answer, but they know that is the right answer. And as soon as they commit to it, and if they can verbalize the answer, yes, it's going to get worse, their paradigm has changed, and you've got a conversion. So again, ask the proper questions. That's the way to get them to change their thinking. And then the last one here is train and role play with your team. So conversion is an act of leadership. So don't be afraid to raise your bar. And remember, you're converting people. Let's boil this down and say you're selling chiropractic, not to them. You're selling chiropractic for them. You're changing their life. So get good at communicating chiropractic. use your x-rays, use that as leverage to show them the dysfunction on their nervous system and show them that that is the biggest destroyer of full life expression. So you're not converting them, you're not doing that to them, you're converting for them. People are sick and suffering and dying with nowhere else to turn. And I can't tell you how many times we shared this statement with our staff that people in our community are sick, suffering, and dying. They have nowhere else to turn. They're taking drugs. They're in line for surgery. They're miserable. They're depressed. They've got domestic violence going on in their house. Their kids are not doing well in school because they're subluxated, because they're not at their full potential. So they need what we deliver. People in our community need what we deliver. So set the bar high. And the higher you set the bar, the more you migrate towards your dream practice. Guys, we have a school group, and I'll just share this with you. We started a school group called Scale Your Practice. So if you want to join the Scale Your Practice group, it's absolutely free to join. There's all kinds of courses in there. We have chiropractic content nonstop. It's for chiropractors. It's for students thinking about chiropractic school. It's for students that are at chiropractic school, and it's for CAs. And we have content for everybody in there, as well as, like I said, there's some courses. There's a free course in there. There's a bunch of courses for just our clients. So go ahead and, click on the link there or scan the QR code. You can join the school group. Again, it's absolutely free. We'll accept you as a member and just be part of the community.